First up, what is blood pressure? Well, for those of you who've been to the doctor once or twice, your doctor may have taken your blood pressure. Now, your blood pressure typically is done using this machine here, or it can be done using a digital machine, but the blood pressure looks at the force at which your blood hits the arteries as it's leaving the heart. Now, of course, as we know, we've probably all heard about high blood pressure. Having a high blood pressure is not a good thing. Certainly, if you have a high blood pressure, it increases your risk of horrible illnesses and chronic diseases such as heart attacks, strokes, and heart problems as well. So, as doctors, we like to check your blood pressure to make sure that your heart is ticking along nicely and the pressures are not too high. Now, usually you'll see a doctor taking your blood pressure in probably two main ways. First off is a manual way, and this is when they push onto a cuff and they inflate the cuff and they have a listen using their stethoscope traditionally on your arm to see if they can hear your blood pressure sounds. Now, this is probably an older way of taking blood pressure, and it's now been superseded by digital machines which are a lot quicker perhaps and maybe just as accurate as a manual blood pressure. Certainly having a digital blood pressure machine in the doctor's office actually helps them to spend time doing something else whilst they're doing the blood pressure. For example, when the doctor is taking a manual blood pressure, they don't have to focus their attention, listen to the stethoscope. They could be using a digital stethoscope and then doing prescription on the side, so they're getting two things done at once. However, in my practice, I like to use both manual and digital because often we get patients who simply cannot tolerate the digital machines or they may not be effective. And certainly that's when it's really important to always have a manual blood pressure machine in your practice. But of course, you need to know how to use it. First up, a few essentials about a blood pressure machine. This particular blood pressure machine is a manual device, and it's a handheld manual device, which makes it a lot easier to take the blood pressure from the patient. Sometimes you'll notice that a doctor has one of these manometers on the wall perhaps, and then a separate pump in their hand. However, this one has got its manometer here as well as its pump here, so it's just really a one-hand device. It also has a release button over here, which then helps you to release the air from the patient's cuff when needed. This particular blood pressure machine has got one cuff, which is a standard size cuff, but you can also buy different cuff sizes. So, for example, you can get a smaller cuff for smaller arms, and you can get a larger cuff for larger arms. Now, this is really important because essentially the blood pressure cuff should be at least 20% larger than the actual circumference of the patient's arm. This helps you to give a really accurate reading of their blood pressure. If the cuff is too small, the numbers may be elevated falsely, and so we like our numbers to be really accurate. So it's always really important to measure or eyeball the patient's arm circumference to give you the correct blood pressure cuff. Of course, with time, this does come a bit more easily, and you kind of work out what fits the patient and what doesn't. So with my blood pressure cuff over here, it's connected with a tube, usually a rubber tube, and it's on the manometer here. Now, in the old days, we used to have some sphygmometers, which were basically really old school, and they used to open up like so, and they used to be a really big bar of mercury that used to travel up and down the sphig, and you'd be able to see where the levels were rather than a dial like this. And I have to say, I have experienced that in my lifetime, but they are phased out because there is a fear that if, for example, any of those machines break, then it can release mercury, which is a toxic substance. So they're slowly being phased out of medicine, which is a shame because they look kind of cool, but totally understand why they've done that. So there are a few ground rules for when you are taking your blood pressure. It's really important that when you're going to your doctor to have your blood pressure taken, that you're nice and relaxed and calm. If you're really anxious and nervous, then your blood pressure is naturally going to go up. And sometimes your doctor will be able to assess that from speaking to you, and they might try to calm you down or give you a few moments just to take a breather before they do your blood pressure. They'll also ask you to place your hands nice and flat on the table or on your lap and put your feet nice and flat on the floor so you're not cross-legged, because sometimes that can make your blood pressure go up as well. It's also important to have your blood pressure taken when you haven't had any caffeine in the past half an hour, not had any smoking, not been to the toilet or done any vigorous exercise in the past half an hour, because all of those things can actually make your blood pressure increase. Once your doctor has established that you're ready to have your blood pressure taken, they'll then place their cuff onto your arm, and essentially with the cuff itself, you'll notice that there is a tube, which we spoke about before, and there's actually a really nice cheat over here which says artery. Now, this tube should be over the brachial artery, which is on the inner side of the patient's arm. This is because this is where we listen to the blood pressure. So I'm going to place it on my arm and line it up. Then the cuff will be tightened, and hopefully not too tight, and readjusted into position. So over here you can see that the blood pressure cuff is nice and lined over my brachial artery with a tube going down. And we're almost ready for our sounds. So what happens once your blood pressure is being taken? Your doctor will typically put their stethoscope over the brachial artery and have listened for the blood flowing through. Initially, they'll be able to hear a blood whooshing through, and this is essentially the blood pressure, which is the force of the blood going through the arteries. Then eventually they won't be able to hear anything at all. This is because they've managed to occlude the brachial artery so that no blood is passing through. Then gradually you'll notice that the blood pressure cuff is slowly being released. And they're listening for two things, the first of which is the first sound. This is known as the Korotkoff sound, which we're going to hear really shortly in a moment. The first number represents the systolic blood pressure, which is otherwise the top number on your blood pressure machine. This shows that the heart is contracting and it's pushing blood out of the heart and against the walls of the artery. The higher the number, the harder the heart is having to work. So it's really pushing hard to get that blood out of the heart. Now, generally speaking, we speak about target numbers in medicine, and this, I have to say, is really individualized because there are so many different situations where your blood pressure target might be different from the next person. But generally speaking, a systolic blood pressure, or the top number, should ideally be between 120 to 140. Now, like I said, this shouldn't be taken for everybody. Of course, if you are looking for your own individualized target blood pressure, then I'll definitely speak to your own doctor about this, because it can depend on a number of things, such as your age, any medication you're taking, and any chronic health disease that you may have. So as we'll shortly see, we're listening for that first tapping sound. Then gradually what happens is that tapping sound starts to fade, and the doctor will record the number where the sound starts to fade away and stops. This is known as your second sound, which represents the diastolic blood pressure, or the bottom number on your blood pressure machine. And this represents the pressure in the arteries as the heart is relaxing between the beats. So one is for heart is contracting and the other is for heart is relaxing. Of course, like I said, if any of these numbers are elevated, it may indicate that you have a high blood pressure. And certainly an ideal rough target for a diastolic blood pressure usually is around 70 to 80. Now, as I said before, this number may be different in your own circumstances, so it's important to discuss it with your own doctor. So for the purpose of this video, I'll be turning the stethoscope on so that we can all listen together. Of course, for optimal results, it is recommended for you to use some in-ear headphones so that you can hear the sounds a lot more clearly, but let's take a listen and see if we can hear it together. We're slowly deflating now. And so there we have it. What you'll notice that we inflated the cuff. We heard a little bit of sounds beforehand, then we heard no sounds. And as we started to release the cuff, we had the first Korotkoff sound, which is the systolic blood pressure. And then we slowly deflated the cuff until we heard no more sounds. And that was our second, or diastolic pressure. And then once we've got those two readings, we can record our blood pressure. So let's do it again. This time we'll talk about sounds as we go ahead. Okay, so we're inflating the cuff now. And slowly deflating. First sound, no sound, and deflate. And there you have it. So there we've successfully heard the blood pressure with all of the sounds there. So we've heard the first and second sounds, the Korotkoff noises, and I can then record my blood pressure into my file, or the patient's file. And on this occasion, my blood pressure was 90/70, a little bit on the lower side, but I probably do need to eat some food. And so if I did eat some food, it will increase a little bit. But certainly your doctor will be recording your own blood pressure into your file and letting you know what your own target blood pressure should be. And bearing in mind that if your blood pressure is elevated and your doctor finds on a number of occasions where they found that your blood pressure is over where it should be, then certainly it is important to get this treated. All too often I see patients coming in who have got undiagnosed high blood pressure and they don't realise it at all, because usually blood pressure doesn't really give any symptoms, and it can be really detrimental for their health, because if we think about the arteries and how the blood is contracting through from the heart into the arteries, the higher the number of the blood pressure, the more force and the harder the work the heart is having to do. And that can cause a lot of increased stress on the heart, which can lead to illnesses such as chronic heart disease, heart attacks and strokes, and it can be really unfavourable. And often we say that blood pressure is a silent killer because there's not many symptoms. So I do recommend that if you haven't had your blood pressure checked and you are someone who may have some other chronic health conditions, or even just if you're generally fit and healthy, I would definitely recommend you to go and see a doctor, because you'd be surprised how many sort of fit and healthy people that I see who actually have a high blood pressure. I hope you guys have found this video useful, and of course if you have any questions or comments, please don't hesitate, drop me a line in the comment section below, and I'll see you on the next one. Take care and stay healthy.